Hi everyone, this is Dr. Alok Patel with Medscape at Digestive Disease Week 2019. I'm joined right now by Dr. Rasha Khalaf, who's going to talk to me about gastric injury from button battery ingestions. We all know about esophageal injuries, but Dr. Khalaf's study actually will look at gastric injury, which is incredible. Dr. Khalaf, thank you so much for talking with us.
Thank you for having me. It's a pleasure.
Dr. Khalaf, could you tell me about the study and why you chose to look into this?
So this is the first and largest pediatric study looking at gastric injury from button batteries. And really how this started is we had an interesting patient. He was 9 years old who presented to our center in Colorado and had gastric injury and erosion and also a perforation in his stomach, which is a hole where it does not belong, after swallowing a button battery. And we looked at the guidelines, and the guidelines did not recommend removal at the first presentation for this patient, and then he came back and we had to take the battery out because it was still in the stomach after several days. And so then we went to a national conference and we chatted with some of our colleagues and we talked to them about the guidelines and realized that us and other providers nationwide were seeing these cases where there's gastric injury from these button batteries, but there's nothing reported in the literature. So we formed a collaboration to get all of our data together and let the world know and let other clinicians know that gastric batteries are not as benign as we think.
So, because, I mean, the traditional thought
Yes.
is that if you take an x-ray, right, and the battery is past the esophagus,
Yes.
we're kind of like, hey, we're okay, we can let it pass. But you're saying that may not be the case.
Yes, and our guidelines from the National Capital Poison Control Center and our own Society for Pediatric Gastroenterology, NASPGHAN, tell us that it's okay and it's safe to observe these patients, especially if they're older than 5 years old and if the battery is less than 2 centimeters. But in our study, we show that 60% of patients who had gastric batteries had visible injury on endoscopy.
60%.
Yes, 60%. And that was a wide range of injury. And so there's some mucosal erosions, we saw some ulcerations, but some patients even had deep burns to their gastric mucosa.
Now, one thing I have to ask, now, when you were looking at the patients that had these gastric injuries, was there any type of pattern you were seeing in the age range or the duration of how long the battery was in there before they presented?
Yep. And so there's two parts of that question. And so all of our centers who collected data are tertiary care centers.
Okay.
So the average time of removal for these batteries was about 15 hours. And we looked at correlation between the time of how long the battery was in there and injury, and we noticed that there was no correlation. And we know from other studies, it only takes minutes to just a couple hours for batteries to cause injury in the esophagus.
And people, I mean, maybe not physicians, but people think like these batteries leak, but it's not necessarily leaking. It's the fact that they can cause an alkaline burn. And you're saying that burn can happen in the stomach just as easily as it can in the esophagus.
Yes. Yeah.
So now, have you seen cases where the radiologist says, hey, this might be distal to the esophagus, we're okay, when in reality it was in fact in the esophagus, or vice versa?
Absolutely. And in our study, we didn't ask that specific question, but I can tell you that the one patient who had the gastric perforation, initially the first x-ray that was obtained, it was read as distal to the stomach, but it was actually in the stomach, because when he came back again, that patient came back again, the battery was still lodged in the stomach and was now eroding into the lining of the stomach. So even an experienced radiologist can be fooled. We always advocate that every physician should look at their imaging themselves, and if you are in doubt, get multiple views.
Did you hear that, residents? Look at the images yourself. Now, just one quick question, because I'm curious, where are the batteries coming from? Where are the kids finding them?
Oh, these batteries are everywhere. You know, they're so cheap, they're widely prevalent, they're in greeting cards, so if you get a singing greeting card, there's a battery in there, and if you give it to your child and your child is playing with it, be cautious, because if they pull easily, they can get that battery out. They're in remote control, so if you have any products that have remote controls, make sure that the battery in there is secured. So a lot of them are not secured with screws. They're in watches, and sometimes parents replace an old battery and they take it out and they think, oh, it's dead. They leave it sitting on a counter, in a jar somewhere. It looks just like candy. The kid swallows it, and even old batteries can cause significant injury.
Old ones. So we know the batteries are present, kids are gonna get a hold of them, and based on your findings, we know they can cause injury and it's pretty serious. So what is kind of like your take-home point for all the pediatricians, family doctors, ER doctors, GI doctors, the people that are seeing this? Like what do you want every doctor to know about your findings?
And so we want everybody to know that these batteries are not only harmful to the esophagus, and we know in the esophagus they can cause bad damage, including death, but they can be harmful to the stomach lining. And we want them to know that harm and injury does not correlate with symptoms. In our study, only about 20% had symptoms, but we know 60% had injury. So we want providers to be aware of gastric damage, and we want providers to pull out these batteries from the stomach.
Get them
promptly.
out.
Yep.
The word is out. Dr. Koloff, thank you so much for your work. It's going to make a difference. Everyone check out the article.